For more on this, we're now joined by Chairperson of Dingaka Association, Obakeng Mooki, and he joins us now via our telephone line. Obakeng, thank you so much for your time this evening. Of course, just looking at that insert, you as those who practice traditional medicines took part in a protest march, calling on for, of course, your practices to also be included in our clinics and hospitals.
Thank you, ma'am. Let's first clarify this. What we are saying is, one, it's a high time that now we start to have indigenous hospital where our traditional healers can practice their traditional medicine within their own traditional indigenous hospitals which practices traditional medicine.
So are you calling on for your own separate traditional hospital?
Yes.
And, you know, looking at this call that you are making when it comes to the response you've been receiving from society and those who have been consulting with you, you know, do you feel as if, you know, this could access a number of South Africans who seek the type of treatments that you provide?
Yes, ma'am. Let's look at it from this point. One, it's a fact that traditional healers are the first point of entry when a person starts to get sick in terms of the primary health care. Now, it will also ease the burden on clinics and hospitals where we need to give the citizens or our people a chance to choose in terms of which service they would rather be given.
Does tradition? Yeah.
And this, we're learning from the COVID pandemic, where we've seen the emergence of people using traditional medicine to ease or to relieve some symptoms, your linganas and other traditional medicines that were used at that time, and the interventions that came from the traditional health perspective.
And perhaps maybe just give us an insight there when it comes to the role that traditional medicine plays. You know, I mean, you even touched on the issues around COVID. I remember it being a big issue and a number of people resorting to use traditional medicines. What role does traditional medicines play in our society?
From the researches that have been out there, though it's listed as benefit of using traditional medicine versus how really traditional medicine can cure or help people in terms of other diseases. I mean, there are studies conducted on your African potato which have good scientific background and validation in terms of it can be used, and other medicinal plants. And all we are saying is then, let's take the truth now to have special centers where people can now go to the centers instead of most of the time when you hear about traditional medicine, traditional healers, we are always on the wrong side. You see, a Sangoma, some place administered this medicine and it has killed it as a person. But if government starts to say, let's explore or even pilot such centers, how it will be of benefit to to the health system at large.
Yeah, and I'm sure, I mean, with this call, it also then talks about the regulation of traditional medicines, if it is really in one center. Perhaps also just give us the insight when it comes to government. I'm sure you've been trying to engage. I mean, the protest action taking place today, that MOU being handed over, or that memorandum being handed over to the Premier's office. I mean, what has been the response from the provincial government?
We are still awaiting the response, but our relationship in terms of traditional healers and the Northwest government, it has been good. We have a very good relationship. It's only that there are some burning issues that we feel needs to be attended to, and at greater pace or at some speed, to say, let's look at this and how it will help the broader community out there.
All right, Mr. Mooki, thank you so much for your time. That is Obakeng Mooki. He is the chairperson of the Dingaka Association.